The gender equality is a very important and crucial issue to question ourselves as active citizens as well as civil society organizations. Do women face higher level of discriminations? In which areas of the life? In March 2020, during the presentation of the Gender Equality Strategy, the President of the European Commission, Ursula von der Leyen, had stated, gender equality is a core principle of the European Union, but it is not yet a reality. In business, politics and society as a whole, we can only reach our full potential if we use all of our talent and diversity. Using only half of the population, half of the ideas, or half of the energy is not good enough. The same period with these announcements and the announcement of the strategy, the European Union strategy for gender equality, a COVID-19 pandemic had dominated all EU countries, and not only, of course. It was a global pandemic. This causes a lot of much more difficulties, as we all have experienced and we know. So in the today webinar, we will try to go through the consequences of the pandemic and the reaction of the grassroots organizations on the topic of women, especially, focus more on the women. So we have invited representatives of grassroots organizations and experts from Greece to share with us their experience, reality, and practices to support women who have been affected by the pandemic in their work, social, and domestic life. Two grassroots organizations, members of the Greek Antipoverty network. One is the Roma Women Association of Dendropotamos. With us will be the president of the association, Yannoula Magga, and the Ladies Union of Drama is an association of women who support poor people and have also a shelter for women who are violated, and also with us is the Spyros Psychas, who is an expert on social issues and board member of the Greek Antipoverty network. They will present their own experience and practices, but also they will be very happy to receive comments and questions from all the participants. Also, we will be grateful if some participants bring into the discussion the experience from their own countries. In between, we will give some minutes to do a quiz on the themes the speakers will deal with and to watch a video on domestic violence produced by a women's social enterprise, which is the name is FEMARTACT, based on a true story that took place during the first period of the pandemic. So before we go on and we pass to this interactive quiz that we invite all of you to do together, I would like to share, I will try to share with you the fact sheet of that European Union, European Commission has published on the gender equality strategy, which is according to the official statistics numbers. You can see that we all see that the 33% of the women in the EU have experienced physical and/or sexual violence. the 55% of women in the EU have been sexually harassed, and women are more likely to experience online sexual harassment than men. So you can see that the numbers are quite high. Also in work space, we can see that women in the EU earn on average 16% less than men per hour. Only 67% of women in the EU are employed compared to 78% of men. And of course, 75% of unpaid care and domestic work is done by women. If these are the official numbers that the Eurostat presents, we can think how serious is the situation and what are the problems and the difficulties and the discrimination that the women face. So, okay, we can going on discussing and saying a lot of things. I stop here and I pass the floor to Mado, who will share with you the small quiz, introductory quiz to the topic of today's discussion. Thank you very much.
Hello, this is Mado, and it's nice to meet you. We thought that we could include a little quiz so that there is a little bit of interaction in today's webinar, because we are, okay, almost 30 people here. So just for some images, you know, to help us go through the day. And I'm going to share, it's a very short quiz with just 5 questions that put things into perspective. And I would like you, if you know the answer to something, I would just like you to raise your hand and you know, try to find the correct answer, although I'm sure you're very familiar with the issue. So I'm just sharing my screen. As I said, there are just 5 cards. This is the negative impact of the COVID-19 pandemic on women. First question reads, of the 49 million care workers in the EU who have been most exposed to the virus around, how many are women? Can you maybe imagine? Yes, Eleni.
Good morning, everybody. I would dare to say 58%.
58%. Okay, let's see. Well, yes, it's even more than that, like 78%, which shows how difficult and challenging the situation is. And we know this very well in Greece as well, because the nursing profession is, you know, quite mainstream for women, as I guess it's in the rest of the EU. How many girls and women were pushed into poverty as a result of COVID-19 in the year 2020? That was the, you know, the big crush of the pandemic. Is it 47 millions, 25 millions, or 12 millions? I don't see hand here. Can somebody take the initiative and answer? That's fine, just open your mic. Oh yes, Andrea.
I'm not really sure, but I would say 47 million.
47 million, yeah. I think that when we aim for the largest number, unfortunately in these cases, we're mostly correct. How many women lose their lives to domestic violence every week in the European Union? You should say. Eleni again, okay?
Yeah, I think it's not that I aim for the highest, but I know that the number is very high, and I'll go for the 50. Yeah.
Of course, the 50. Yeah. Yes, it doesn't show if it's correct or not, but I'm okay. Great. Before the end of 2021, which just ended, how many femicides were committed in Greece? which is a fact that not very well known, although some of the European media have covered it. Unfortunately, yes, from the Ladies Union of Drama, Konstadinos, I think.
Yes, thank you.
Yes.
18, unfortunately.
18, unfortunately 18, and counting, of course. 2022, unfortunately, has brought more. How many Europeans believe that violence against women is common in their own country? This might be a bit challenging. I don't know. Yes, Andrea.
It could be 74%.
Yeah, let's aim for the highest here, and it is the highest, unfortunately, which means that European people do have a sense of what is going on, and they do understand how big the problem is, hence this particular webinar that we decided to do. Thank you for completing this quiz for me, and I will just stop sharing my screen now.
Okay, I hope that we got an idea how is the situation and how crucial is the situation in all over Europe. And the first topic we deal with is about the women in health and care sector, work sector. So I invite Spyros Psychas, who is next to me, to present the situation in mainly in Greece. Thank you, Spyros, and welcome.
Okay, hello. Well, I'm happy we are all together. Well, I'm just member of the board of the Greek Antipoverty Network, and we try to see what's happening. So we see some researches recently reported, and also we have spoken with women who work in the health sector or in social services, etc. So that's what I'm planning to present. So we know that more or less women are exposed to, they are eager to offer as workers, as volunteers, etc., etc. In Greece, it's an issue how men could participate more. And well, this has to do with the volunteering issue. We see that the women, they do not work only in social services, in social support services, but they have to serve their house. They have to serve their parents, fathers, mothers, grandfathers, grandmothers, children. They have to be okay in their job, and they have also a social environment. So it's a complicated situation. They have to balance, and they are pressed more than anybody because of their role. Also, we see that usually women in the social services are working in positions that they do not get, usually they don't get public recognition, or they don't speak to the media. It's easy to see a doctor, a director of an apartment of the hospital to speak about the COVID problem and what's happening, than to see a nurse speaking about what are the real problems they face in a COVID department. So, by the way, I would like just to give you a few numbers, a few figures. For example, speaking with the Association of the Social Workers in Greece, we see that 9.5% are men and 90.5% are women. This means that more than 90% of the workers as social workers in Greece are women. also in the health sector. I will present you later on a research which was presented 2 days ago, that we see that 83% of the workers in the health sector are women, and 17 or a little bit less are men. So although I have not special research about women,
Okay.
we can speak a little bit about the situation, comparing data from different sectors and fields. So I was speaking about the social workers, and we know that the social workers during 20, in some cases, they were excluded. They could not work normally because they could not be in their service. So many people from socially excluded groups could not get support. But during the last year, in 21, that more or less the social services were open, we see that they were really overloaded. For example, social workers, they stopped working in the centers for elderly people, and all with all the other workers in the field, they worked to help handicapped people or elderly in their houses, in the social services of the municipalities, in the social centers of the municipalities, where they offer advice. It's a kind of advice center, and they help the people to, for example, to apply for the minimum income benefits, because the people, they cannot manage with the bureaucracy, etc. So even when distributing food in houses, they had to do it directly to the people who cannot manage, that maybe they are partly handicapped. So we see they were really overloaded about the social workers. Now, if I see people working in hospitals, especially in public hospitals in the health sector, we see that in most cases in Greece, the people were demonstrating, and because they were feeling that the Greek government didn't support, didn't prove the situation to help them face all this unknown enemy. So from the one side, they were afraid to get the virus. On the other side, not to pass it to their family or to their old mother, father, grandmother, grandfather, children, to their friends. We have many cases that people were, women were somehow isolated because of that. And also they had to manage with the stress in their job. In Greece, we had also other things. For example, in some cases, the people working in hospitals, they were demonstrating, and some politicians, they clapped, bravo, bravo about your job, bravo that you work so much, that you work much more time, that you manage with this big number of patients. And nevertheless, afterwards, the people, they didn't get the money for their additional work, most nights, hours, etc. So from the one side, bravo, and on the other side, nothing. So the burnout problem is really big, and the question is how women in the field, they manage to deal with that. So we see that there are different approaches and different strategies. For example, the research shows that passive strategies, that it doesn't matter. It's nothing serious. We will manage. I believe in God. That do not work. They do not work. The energetic strategies, more information, improving social bonds and social relations, helping other people. We see in some cases that workers in the public hospitals, despite the fact that they were so much overloaded in their job, they were at the same time volunteers in some volunteer initiatives, solidarity initiatives, and they would like to help other people. For example, the telephone centers for COVID in Greece, if you try to call, you see a line busy. And they established, for example, some other lines just to give friendly, direct information to the people. So we see people who were at the same time so much pressed to be volunteers at the same time. And this improved their psychological situation and helped them to feel that we offer more. So I just say that energetic strategies are more efficient. Of course, the big issue was the fact that they were feeling that they need a better organization, infrastructure, materials, more staff, etc. And of course, they needed psychological support, although in many cases, the people, they were so pressed, women were so pressed to manage with their obligations in the working environment that they had no time to get support themselves. And we see that through all this difficult situation, they empowered themselves. And we see that they managed to respond to their duties in an extreme degree. And this is unbelievable. Me personally, as a citizen, when I see what's happening with the hospitals in Greece, I'm wondering how they still manage. I will find in English, because we have it in Greek for the moment, this research I was telling you about. It's a day center, Babel, in Greece, in Athens. This Babel center, they made a research in the health sector, especially for COVID, the departments, etc. They got interesting data about what happened. So what happened about burnout, what happened about how women managed in all this situation, and so on. Have in mind that also they had also another problem, that maybe 80% of the people in the public hospitals, they were not vaccinated. So another big problem, you are responsible for what's happening in the public hospitals. And another problem concerning the working environment is that some thousand people, around 6,000 people, I think, it is possible they will get eventually fired because they are not vaccinated. And for the moment, they have stopped working, making more poor the workforce, the people working in the hospitals. And also another relative problem is that all the women who were working in these difficult departments, they had also to support new workers who would come just for some months, and they're not permanent workers, and they had to train them to offer them guidance. So at the same time, you have to do everything, and you have also to train the newcomers who we don't know if they will stay longer. There are figures about how that, for example, the women who were working in these difficult departments, that they were feeling the people to die every day in front of them, that according to the law in the COVID, the emergency COVID departments, they had to work, for example, 4 hours per day instead of 8 hours, and the rest to stay. It was impossible. You can understand it, that obviously it has happened also in other countries, but if you are during the whole time of your job in the very emergency situation, then the impacts are really serious. Yes, Yota, about the poverty, we can say about the poverty issue, we can say just that although we have so many women working in the social sector, we didn't see any financial assistance to them. Just to add the bravo and clap with something that really could help them, yes, to manage with the additional obligations of this period. Well, this is an opening of the issue. There are many details. Maybe we can speak a little bit later about this.
Okay, thank you, Spyros. There will be the session question and answer, so there maybe we can, you have the opportunity to share more
yes,
on this topic. Now I invite Yannoula Magga, okay, to share with us their experience from the Roma community of the Dendropotamos. Yannoula is going to speak in Greek, and Mado will try to make the interpretation in English. The floor is to Yannoula. Yannoula,
Good morning. Σας υπερευχαριστώ για την δυνατότητα που μου δίνετε. Όπως είπε και η Γιώτα, είμαι η Μάγκα Γιαννούλα, πρόεδρος από το Σύλλογο Γυναικών Ρωμά, το οποίο ιδρύθηκε το 2002, εδώ και 20 χρόνια, με 470 μέλη, γυναίκες, μάνες με πολλά παιδιά, που βιώνει τον αποκλεισμό, όχι με το COVID, αλλά εδώ και πολλά χρόνια. Εμείς το COVID τον βιώσαμε με πολλή δυσκολία, γιατί οι κοινότητες Ρωμά ζουν σε μια πολύ δύσκολη κατάσταση και άθλια κατάσταση. Και ήρθε ο οργανισμός μας να αντιμετωπίσει, και βεβαίως και όλοι, πρωτόγνωρες συνθήκες και για μας, για τους Ρωμά, και πιο πολύ δύσκολες. Για το θέμα ότι γενικώς οι Ρωμά, οι περισσότεροι, είναι άνεργοι.
Just said that, of course, is very grateful to be with us. She is the president of the Roma Association for Women of Dendropotamos, which is a particular area in the north of Greece, near Thessaloniki. She's been the president of the association. The association was founded back in 2002, so this year they celebrate their 20th anniversary. It has 470 members, mostly who are women, and most of them are mothers with a lot of children, coming from large families, that is experiencing social exclusion, not just with COVID-19, but in many more aspects of their lives for many years, many more years than just now with the pandemic. And of course, now with this unexpected difficulties, the Roma Association has been asked to tackle a problem that for them it's 1,000 times more difficult, because most of the Roma people live in very destitute conditions, and since most of them are unemployed.
Η πανδημία ήρθε να αναδείξει τη φτώχεια και την αθλιότητα σε όλο το μεγαλείο της. Για τους λόγους ότι αφενών γενικώς οι Ρωμά έχουν χαρακτηριστεί σαν υγειονομική βόμβα, δηλαδή αμέσως μας στοχοποιήσανε για το θέμα ότι τη στιγμή σε ένα σπίτι, όταν δεν υπάρχει μία δουλειά και η πανδημία έφερε στους ανθρώπους που εργαζόντουσαν, μπήκαν σε αναμονή, ναι, σε καραντίνα, οι άνθρωποι εργαζόμενοι είχαν επιτέλους μία μέριμνα ότι μπήκαν σε αναστολή από την εργασία τους, αλλά θα μπορούσαν να πληρωθούν. Οι Ρωμά ήρθαν αντιμέτωποι ότι δεν υπήρχε μέριμνα για αυτούς και ήρθαν να αντιμετωπίσουν τη φτώχεια και την δυσκολία 100%. Γιατί το λέμε αυτό? Ο Σύλλογος Γυναικών ήρθε να αντιμετωπίσει, γιατί οι άνθρωποι αφενών δεν έχουν το τρόπο της επικοινωνίας, δεν μπορούν το ίντερνετ, όλα αυτά να βοηθηθούν με τηλέφωνα, δεν έχουν νερό στους καταβλισμούς που ζουν και η ίδια η πολιτεία φώναζε να πλένουμε τα χέρια μας, να υπάρχει σωστή υγιεινή και όλα αυτά. Ήρθαμε να αντιμετωπίσουμε πάρα πολλά σοβαρά προβλήματα και για το θέμα της επιβίωσης ακόμη. Μας παίρναν τηλέφωνο και ειλικρινέστατα δεν είχαν ένα πακέτο μακαρόνια μέσω σπίτι τους για να μπορέσουν να ταΐσουν τα παιδιά τους.
So Yannoula started talking about how the pandemic brought to light the poverty and the destitute conditions in which these people live at a very large scale. And first of all, because the Roma people were considered and reported from the Greek mainstream media as a hygienic bomb. So they were stigmatized from day one. And she's making the comparison with everyone else who, of course, I mean, she understands that people have been left without jobs and have been left unemployed and in difficult working conditions, but they were in quarantine, but they still had the chance to be paid somehow. She's talking about another group of employed people, other groups of people. However, in the Roma community, this was not an opportunity. There was no opportunity for that because there was no actual care taken and provisions provided by the government. So they had to tackle a lot more difficulties. For example, they received phone calls from people who lived in their community, who of course didn't have internet connections. They couldn't use all the other technical outlets that the rest of the people have. And of course, they didn't even have water in their houses, so they couldn't comply with the rules about washing our hands all their houses because they lack running water services. And there were people who didn't even have a packet of spaghetti to feed their children.
Και μιλάμε για οικογένειες που μέσα σε ένα δωμάτιο 40 τετραγωνικών να ζουν 6 και 7 και 10 άτομα ακόμη και να έρχεται η ίδια η πολιτεία να λέει για μέτρα, να προσέχουν και όλα αυτά. Και μια μάνα όταν έχει να ταΐσει 5 παιδιά και δεν έχει μέσα στο σπίτι της τίποτα, θα αναγκαστεί βέβαια να βάλει σε κίνδυνο την ίδια τη ζωή της, την ίδια την οικογένειά της, για να μπορέσει να βγει, να εξασφαλίσει ένα κομμάτι ψωμί ειλικρινέστερα για να μπορέσει να γυρίσει στο σπίτι της, να μπορέσει να προσφέρει κάτι στα παιδιά της. Βέβαια, ο Σύλλογος έπαιξε σημαντικό ρόλο σε αυτό, ό,τι μπορούσαμε, γιατί την πολιτεία το κράτος, και ζητώ χίλια συγγνώμη που το λέω, το ζήσαμε σε όλο το μεγαλείο της. Ζητώ χίλια συγγνώμη, πάντα συγκινούμε για αυτό που λέω. Αυτό το απρόσωπο, γιατί ο άνθρωπος όταν είναι καλά, πολεμάει για να μπορέσει να επιβιώσει. Αλλά όταν έρχεται μια πανδημία να αποκλείσει τον κόσμο, εκεί καταλαβαίνεις πιο πολύ αυτό το απρόσωπο που υπάρχει, που δεν υπάρχει κοινωνική μέριμνα για αυτούς τους ανθρώπους, γιατί εντάξει, ίσως και το ίδιο το κράτος μας να βρέθηκε μπροστά σε μεγάλη έκπληξη, γιατί η πανδημία ήταν πάρα πολύ δύσκολα και ακόμη δυσκολότερη. Ο Σύλλογος ό,τι μπόρεσε, βέβαια και με τις οργανώσεις, και τους ευχαριστούμε πάρα πολύ, και τον οργανισμό εδώ καταπολέμησης της φτώχειας, που μπόρεσαν έστω να μας ενθαρρύνουν, να πάρουμε δύναμη από αυτούς. Μπορέσαμε και από τα σπίτια μας, βγάζαμε τρόφιμα ό,τι μπορούσαμε, εμείς λίγο που μπορούσαμε, για να βοηθηθούν αυτές οι οικογένειες όσο μπορούσαμε να βοηθήσουμε.
Yannoula is a bit emotional talking about this. So she went on to talk about the difficult conditions that these people live in. For example, they live in a room of 40 square meters, up to 10 people. And this at the same time that the government talked about measures to be taken, while a mother was trying to feed her 5 children, putting her own life into danger, having to go outside and look for food for the family. The Association of the Roma Women of Dendropotamos have been quite active, and they did their best with the help of other organizations and with also the moral support and encouragement from the Greek Antipoverty network. But of course, the complaint is against a government that hasn't shown any social care for these people. And that, of course, Yannoula says that she understands that the government also was taken by surprise with this pandemic, but they should have done better for this particular community.
Και τι να πούμε και για την ενδοοικογενειακή βία. Εκεί ήταν το μεγαλύτερο πρόβλημα για μας που ήρθαμε να αντιμετωπίσουμε. Γιατί οι γυναίκες δεν μπορούσαν να επικοινωνήσουν. Γιατί όταν δεν ξέρεις να χρησιμοποιείς τη τεχνολογία σε αυτές τις δύσκολες στιγμές, διονγκώνεται πιο πολύ το πρόβλημα. Γυναίκες που ειλικρινέστατα είχαν πρόβλημα ενδοοικογενειακής βίας μέσω σπίτι τους, με τους άνδρες, βιώσαμε μια πάρα πολύ δύσκολη κατάσταση. Από αυτό καταλάβαμε ότι πρέπει ο άνθρωπος να μπορεί σε αυτές τις δύσκολες στιγμές να ξέρει τι να κάνει. Η πανδημία μας έκανε και κακό, αλλά μπορώ να πω και καλό. Γιατί ήρθαμε να καταλάβουμε ότι οι γυναίκες πρέπει να είμαστε πιο... να απλώσουμε το χέρι μία στην άλλη, για να μπορέσουμε έτσι να βοηθηθούμε. Γιατί μόνο η συλλογικότητα φέρνει καλά αποτελέσματα. Δηλαδή και από το θέμα της ενδοοικογενειακής βίας ήταν πάρα πολύ δύσκολα, γιατί αυτές οι γυναίκες δεν μπορούσαν να ζητήσουν βοήθεια από πουθενά, και εκεί ακόμη, αν μπορούσαν να καλέσουν την ίδια την αστυνομία, μόνο στο άκουσμα ότι θα άκουγαν ότι είναι Ρωμά, δεν θα ερχόντουσαν την κατάλληλη ώρα. Άρα είχαμε να αντιμετωπίσουμε αρκετά μεγάλα προβλήματα, αλλά εγώ θεωρώ μας έγινε μάθημα ζωής πλέον να δουλεύουμε πιο εντατικά και πιο συλλογικά και με τις γυναίκες, και να μπορέσουμε να είμαστε έτοιμες σε κάθε δυσκολία και σε κάθε πανδημία.
And now Yannoula went on to the very big issue of domestic violence, which has been exacerbated during the pandemic, also in the Roma community, which faced, however, the very, very big challenge of not being able to communicate through technology and talk to people and file a complaint, a formal complaint about this, because as we said before, they lack IT skills, they don't use the internet and so on. So even if they did manage to call the police, hearing that they would have to go to a Roma community incident and case, they wouldn't respond. But she also mentions that the pandemic has done both bad and good. Good in the sense that they realized also in the association that they have to work more closely with women, they have to show more solidarity, and they have to work more intensely so that they are more prepared next time something like this happens.
Θεωρώ ότι ναι, θα τελειώσω. Απλά θέλω να ευχαριστήσω και ζητώ χίλια συγγνώμη από τους παραβρισκόμενους. Δηλαδή, αν δεν υπήρχαν και τα δίκτυα, αν δεν υπήρχαν και οι οργανώσεις που να μπορέσουμε έστω να ζητήσουμε βοήθεια από θέμα ενημέρωσης για την οικογενειακή βία, για αυτά, γιατί τρέξαμε να βοηθήσουμε γυναίκες ακόμη με κίνδυνο τη ζωή μας, να μπορούν να συνδεθούν, να μπορέσουμε να μοιράσουμε πράγματα, να μοιράσουμε εννοώντας πράγματα, ηθική βοήθεια σε αυτούς τους ανθρώπους, ψυχολογική ακόμη στήριξη σε αυτές τις γυναίκες. Και να σας πω, ό,τι κάναμε, το κάναμε εντελώς με δικιά μας πρωτοβουλία και βέβαια και με οργανώσεις, αλλά άτυπα, γιατί δεν είχαμε κάποιο πτυχίο ψυχολογίας, αυτά, ό,τι μπορέσαμε προσφέραμε. Τώρα εγώ καμιά φορά όταν μιλάω για την κοινότητά μου, συγκινούμε και όταν έρχομαι στο σημείο ότι δεν είχαν ένα πακέτο μακαρόνια, ένα βράσο στο σπίτι σου, εκεί πλέον συγκινούμε. Αλλά θεωρώ ότι είμαστε μέσα στο πεδίο εμείς που βιώνουμε πράγματα, γιατί δεν αναφερόμαστε σε ανθρώπους που κάνανε μία έρευνα και μετράνε νούμερα. Εμείς μετράμε ανθρώπους, ψυχές, γιατί καθημερινά ερχόμαστε αντιμέτωποι με αυτούς τους ανθρώπους. Δηλαδή, το βλέμμα μας αντικρίζει αυτά τα βλέμματα και δεν μιλάμε με νούμερα, μιλάμε με ανθρωπιά και με αυτούς τους ανθρώπους καθημερινά ερχόμαστε σε επαφή. Σας ευχαριστώ πάρα πολύ, ειδικότερα το δίκτυο που μου έδωσε αυτή τη χαρά να μοιραστώ μαζί σας.
Ωραία. So Yannoula, closing, she said that she was very lucky to have various networks and organizations to ask for help herself, to ask for information that she could disseminate then to the people who had especially the women who face domestic violence in her community. And she wanted to point out that she and the other members of the board and so on, the people who volunteer in this association, they had to go to help these women. They had to go to their houses, putting themselves into risk, putting themselves into danger because they didn't know what they were going to face there, and having to psychologically support these women without, however, having the typical degrees and skills to do so because they don't have the chance to be educated about that. So having information by the organizations who work also on this particular topic has helped them very much not to make a lot of mistakes. Because she says that she needs you to remember that these are the people who work in the field. They're not some scientific organization doing research and talking about numbers. They actually come in touch face to face with these people, so they know what they're talking about in their daily life. And she's thanking everyone for your patience.
Yannoula gave us a good
Representation?
No. A good opportunity to share with you the video I told you at the beginning on the domestic violence, since she referred to this issue, and the next speaker from the Ladies Union of Drama also he will share with us some their own experience on this topic, also on other topics. So give me 1 minute to share with you the video. Η Αλεξία το έχει κάνει αυτό. το ακούμε, δεν το ακούμε. Το σταματήσω. I hope that I don't have to say more. I think that it was very clear what is happening in Greece. maybe in other countries also. We hope that we receive from you some inputs on the situation in your countries. Fortunately, the pandemic influences women to raise their voice, and also all of us to develop a solidarity actions for the people, the women, they face the domestic violence. And I take 1 minute to say a few words about the social enterprise that they made this small video, short video. The name is FEMARTACT. And is a social enterprise composed by Greek women, Greek activists, and refugee and migrants women. So the Greek activists train the migrant and refugee women in actively participate in shooting and in composing the videos and present them. They participate in international movie festivals, and they got already some awards. Now I would like to pass the floor to the Ladies Union of Drama. I suppose that Konstadinos is going to talk. Konstadinos, welcome, and we are listening to you.
Hello, thank you everyone for being here. Thank you very much for inviting us to share with you what we were called to experience in the field during this pandemic situation. Please allow me to share my screen. So first, I will make a very brief presentation of our organization, its causes, and then I'm going to talk about 2 issues that we were called to face. The first being domestic violence and gender-based violence, and the second one, the unpaid care sector, where a lot of issues arise for women in general and our beneficiaries as well. Ladies Union of Drama, the organization I represent, is a recognized non-governmental charitable association based in Drama, which started its operation unofficially in 1904 and acquired its first statue in 1929. During 1990 and 1995, there was the purchase of the building that became the House of Open Hospitality for abused women and children, where we provide shelter to anyone of these groups that is in need. And our other activities beyond provision of shelter include psychological and legal aid, food, material aid, education, vocational guidance, training, as well as we try to provide medical and pharmaceutical coverage. So regarding the COVID-19 pandemic and women, during this period, during the exacerbation of the pandemic, we were all called to face unprecedented, tough and dangerous situations. People around us who, due to either financial or social causes, were in difficult situations, were in an even more dire situation. And meanwhile, there were a lot of other people who were, for the first time in their lives, facing an emergency due to this pandemic. In our country, in Greece, of the financial and humanitarian crisis, the pandemic brought on the foreground even more problems concerning health, public health, mental health as well, and finances. Here at Ladies Union of Drama, we never stopped working with patients and caused us persistence throughout the whole duration of this special and demanding period, so that not one day passes that we do not help someone who is in need. After all, this is our philosophy to always... Yes?
Κωνσταντίνε, συγγνώμη, δεν κινείται η παρουσίασή σου.
Oh, okay. Excuse me,
We
yes,
are
yes.
in the first slide still.
Oh, I had it on full screen, maybe.
Now
Okay.
it's fine. Okay, history, areas of activity. Perfect, thank you.
Okay, great, thank you very much. So one of the populations, as we know, that is disproportionately affected by the pandemic were women. And since our foundation, we have always been on the side of women, trying to provide them with holistic support. The first issue we had to face was the increasing cases of gender-based violence and the increased cases of women that had to face unemployment and the greater need of unpaid care work. So regarding the first issue, the way we operated was to provide help by our House of Open Hospitality, which is hosting abused women and children, victims of violence. Gender-based violence is by itself a pandemic within the pandemic due to the variety of stressful factors, psychological factors. The case of abuse were increasing dramatically, and we offer psychological, social, legal, and professional support to women who come to us who are victims of gender-based violence in a safe space in order for them to be empowered and to be able to gradually reintegrate in society without fear. In particular, the organization also has specialized personnel, including a lawyer, psychologists, social workers, as well as a volunteer network of lawyers and mental health specialists who are properly trained to offer the services. In addition, we operate a helpline for the support of abused women and children. And we cooperate with the General Secretariat of Demography and Family Policy and Gender Equality and the Centers of Women's Council throughout the country to combat the phenomenon more efficiently. A new initiative we began during this period is the Time to Talk project, which implementation began in the 1st of December 2021. The project has a duration of 14 months, and the main pillar of this project is the training of the organization in order to be able to work, to handle, to provide counsel to perpetrators of gender-based violence. The training will be provided by the Norwegian organization Alternative to Violence, which has more than 30 years of experience on the subject. And we will also cooperate for this with 3 Greek universities, in particular, the Democritus University of Thrace, University of West Attica, and the University of Peloponnese. In parallel, nationwide research is going to be conducted about the new and emerging types of gender-based violence in order to raise awareness for the younger generations. The project is implemented in the framework of the Active Citizens Fund, with LDU as the implementing body and fund operators for Greece, the Spyros Psychas Foundation and Solidarity Now. So we try to incorporate during this pandemic a wider area of activities regarding this very pressing issue of gender-based violence to target the root of the problem. And we hope that it will be proven very successful and we will be able to increase our impact in this area. Regarding the second issue, the lack of employment and the increased demand for unpaid care work, the data is still concerning because due to the lockdowns, many enterprises were closed, many workers were fired or were suspended from work, and as well as working mothers had to take unpaid vacation and unpaid leave or leave their job entirely because they had to care for their children during the lockdowns. So this double role of women, of being both an employee and also the care provider, came into an even bigger conflict and really signified a problem, especially for single parent households where the sole provider of care is the woman, the mother, and the dilemma between work and care, the upbringing of their children sharpened In this situation as well, we try to be by their side by providing services, medical and pharmaceutical care when needed, bigger and more frequent food aid and material support to cover the material needs and clothing for these populations that were put in these situations due to their lack of work or due to being called to provide even more care for the families, for their loved ones. And we also had to face fear because a lot of people were away from their families who sometimes had the elderly with no one to care for them. And we tried to connect people in order to find solutions for people that were alone and needed care. So finally, we tried to provide psychological support, mostly through the helpline, the phone, and when possible, we facilitate their search for employment. So our experience has shown that the way to stand by women under any and every situation and keep supporting them in every step of their efforts is necessary for a more equal and autonomous life. Thank you very much.
Thank you, Konstadinos. Now the floor is to all of you. If you want any question, any comment on the speaker shared with us, and also it would be nice if we have your the experience and the practice in your countries. Thank you, Hellenic. Otherwise, Spyros wants to add something on the violence, I think.
Yes. Well, I would like just to give you a figure, not a nice figure, that in Greece we had 18 women killed during the last year. It's a really dark number. According to my figures, I see that this number, comparing to the population of Greece, is relatively double than what's happening in Spain. So it's a big problem this year. But I think the public is much more aware about. Also, the police is much more pressed not to avoid dealing with the cases when a woman come to a police station. You know, this small video, it was very nice, very interesting, because it described what really was happening all the last decades. You go there and you see that now what? Go back in your house, etc., etc. And the woman knew that they will get even more badly ill-treated going back to the house, etc. Also, the legislation doesn't help because you cannot stay in a protected house for a long time, etc., etc. Well, I would like just to tell you that the situation in Greece nowadays was really difficult. And the only good thing is that everybody's aware now of that, in the press, in the radios, everywhere. So, okay. Yes.
Thank you, Spyros. So the floor to Konstadinos to respond to the comments of Eleni and Iris.
Thank you very much for your question. So regarding the first situation, our primary response for serious cases is our House of Open Hospitality, where we can host victims of gender-based violence as well as children. This is the primary support we can provide, and those that are hosted are also provided with services of psychological support and legal guidance and aid, even in courts in specific cases where it's needed. The second solution we tried was increase our number of beneficiaries. A lot of more new people approached us in order to be offered either psychological support, which was very common. Material aid was also very common, and this ties both to the violence factor, but also the the employment and unpaid care work issue, we increased our beneficiaries. We try to increase what we provide to those people to be able to keep themselves safe, to be at home, to take care of their families and children, despite not being currently employed or facing financial difficulties. We also try to, as I said in my presentation, cooperate with counseling centers throughout Greece in order to refer women that are in need to receive proper guidance and action, because each case is specific and requires a different course of action depending on the individual and what she is experiencing. And we try as much as we can to provide vocational guidance and to make connections, so to say, with enterprises for women to find employment and train them to do so, because we believe it's a very important step to become autonomous and escape these abusive relationships and situations. So we have these, we did them, these are our core area of activities, and we have to raise them even higher during the pandemic, and to find ways to do this safely and respecting all the measures, the public health measures. But we did achieve to never cease our operations, even during the lockdown. So we stayed close, very close to our beneficiaries and anyone who approached us and was in need.
Okay, thank you, Konstadinos. Okay. So thank you very much for attending. Before we go, we say goodbye. I give 2 minutes, please, Spyros, 2 minutes to Spyros to make a small summary, and then we say the final goodbye.
Well, I will start from the opposite side. Although, you know, all these European declarations, etc., we have to face the reality, the poverty reality, the discriminations, the ill treatment of women during these 2 years. We faced the COVID-19 pandemic. And I would first I would like to thank the lady from Dendropotamos, Thessalonica, for her intervention, and where she tried to express the extreme poverty and the extreme problems face the Roma communities in Greece. You know, in fact, symbolically, she represents around 300 communities who live in very bad housing conditions, in extreme poverty, without services, without, in some cases, without water and electricity, and in some cases in very bad housing conditions. On the other side, the organization from Drama, in a way, symbolize small but very, very active local organizations who develop very interesting services on housing of ill-treated women, on poverty, facing poverty problems in families, offering social services to the local community. I think we have to tell them a big bravo for their work, because usually they do it without financial support. Also, I would like to mention the intervention from Cyprus. The lady from Cyprus referred to the fact that these problems we spoke about, they refer to all the countries. And it's really good thing that in Romania, for example, we have already some good practices concerning the small changes in the law and concerning the cooperation between NGOs, public services, and municipalities. Now, on the other side, we spoke that we see that in Greece last year we had a big problem concerning the violence against women. And concerning the environment, the working environment of the women who work in the health sector, in social services, and all relative services, 83 to 90% of the people working in this sector are women who are really fighting in front line, trying to help people to offer services. This doesn't happen without personal cost, but nevertheless, and it's really good to see that, we see that in many cases, women manage to overcome the lack of infrastructure, the lack of materials, the lack of appropriate organization, and so on. And they try to offer the best they can, and many cases with personal cost, but also in many cases they overpass their personal limits, and they get the satisfaction that they help in an efficient way the people who come in a social service, in an office of municipality, in the social services, and of course in the public hospitals. I think also from my part, thank you for your participation.
Thank you, Spyros. So what I want to say is that I think that from the today discussion and our everyday experience, we see how important is to try all of us for the success of the gender equality strategy, and much more than this, than what European Commission proposes and suggests. So I hope you enjoy a lot. You will receive an evaluation form, practical things, again, to your email. Please return it completed. And we wish you a very good day. And see you soon on another webinar. Thank you.
Thank you.
Thank you very much.
Thank you very much.
Thank you.
Bye.
Bye.
Thank you, Yota. Thank you, dear
Thank
colleagues
you.
from
Bye-bye.
Greece.
Thank you.
Bye-bye. Thank you.
Thank you.